I think the idea of multiple stimulus screening is new to some people. So what I'll talk about a bit is just maybe explain what a multiple stimulus test is. I think the single stimulus most people understand quite well. So what happens in a multiple stimulus test is instead of presenting just one light at a time, you present a pattern of either 2, 3 or 4 lights. Now, maybe I should backtrack a bit here because multiple stimulus testing is not new. Okay? In fact, the first multiple stimulus test was something called a Harrington-Flock screener, which was developed in America and was used in the 60s regularly as a screening technique. And then that went on to things like the Friedman analyzer had a multiple stimulus test. So it's not something new, but it's unusual nowadays in modern computerized perimeters because it is technically more difficult to present patterns of stimuli than to present a single stimulus. So what would happen in a multiple stimulus test is the patient would be looking into the machine and the operator would say, look carefully at the center, I'm now going to present some stimuli, tell me how many you see. They would then press the present button. The patient would then verbally report the number that they see. So if I show you on the computer here what the operator sees, okay, so this is what the operator would see at the test. What you can see is there are 3 red rings here, and these are the locations of the stimuli that will flash when the operator presses the present button. So for instance, if we go onto a new pattern where there are no dots in the center, which means they've not been presented, we present them and then we ask the patient, how many stimuli did you see? If they say 2, we say fine. We go to the next pattern, how many do you see this time? If they say 3, we say fine, here's the next pattern, etc. with 4. Now if they don't see them all, you represent it, say look again, how many this time? If they still make a mistake, you then ask them where the ones they saw were. And for instance, in this one, they might say, well, I saw one at 11-ish, one at 2-ish, and one at 6. So you then say, oh, you missed this one. Okay? And then you go on to the next pattern and carry on. So what's the advantage of this test? Well, first of all, in a multiple stimulus test, it's much more patient friendly. And this is particularly important for elderly. They don't find it difficult to verbally say, oh, I saw 3 or I saw 2, but they sometimes get flustered if they're given a button to press a certain numbers of time. So it's more patient friendly and generally gives slightly higher quality data. Importantly, because you're presenting more stimuli at any one go, it's faster as well. So it's faster and more patient friendly and probably a little bit more precise than a single stimulus test because patients are more reliable. So the single stimulus version is the patient looks at the fixation light, the perimeter sets it off, a light flashes. When they see a light flash, they press the button and they continue to do that through all the presentations. So just to recap, multiple stimulus tests are faster but require more operator input. They're preferred by patients, particularly the elderly, who can get confused when pressing the button and make anticipatory presses when they didn't see the stimuli, and it's less prone to error. Okay? The single stimulus test, okay, is fully automated. The perimetrist really doesn't have to do anything other than sit the patient down, align them, put the correct correction in, and press go, and it's off. The important thing in the Henson is that the multiple stimulus and the single stimulus tests test exactly the same points. So there's no difference in the result that comes from these two tests. And if you really don't want to do multiple stimulus testing, then fine, do single stimulus. It's the same as the other perimeters in the marketplace. But there is the advantage, we can also do multiple stimulus testing if you prefer that one.
So if you are doing multiple stimulus testing, which gives you a higher throughput because the test is faster by default, do you still have to put in all the patient's details? Does that?
No, this is an important difference. On a lot of perimeters, when you start them, you have to enter the patient's name, date of birth, etc. On the screening tests in the Henson, what happens is that you have to enter their date of birth because the level at which it tests is adjusted according to the age of the patient. But you don't have to enter any more information. If at the end of the test you choose to save it, then it's going to ask you for their name, record number, etc. The dates and time of tests are automatically put in. They pick it up from the Windows clock, as it were. So that information is provided, but you have to enter the name and record number of the patient. Okay? And what this means is that if you're, say, screening a large number of patients, where you probably don't need to save a result because there's nothing there other than they saw all the stimuli, you could just mark the record all seen and not save the record, which makes a lot of sense to me.